HSBC's Chief Asia Strategist joins me here in Singapore. Arjun, it does seem like Obama is taking on more than he can chew. Is that a fair assessment?
Well, I guess the markets certainly seem to have decided that the U.S. is basically over-borrowing, and it's probably setting itself fairly unrealistic budgetary goals. And healthcare reform clearly is a crucial aspect of that whole equation. Yeah, I mean, looking forward, the markets are worried about the dollar, worried about interest rates in the United States, which tend to be heading up, though not on a consistent basis. So the real issue, I think, going forward is this all affordable? I mean, a big sea change in terms of how the U.S. handles healthcare. And at the bottom of all of this seems to me an ideological debate about whether the market works or not. And I think what Obama is telling the U.S. public is that the market doesn't work in healthcare. There are lots of imperfections which have meant that drug companies are charging too much, insurance companies are charging too much and getting away with it. Health providers, doctors, etc., are just fleecing the public, and we are not really getting any healthier. The government has to step in and fix this rot. That essentially, in a crude manner, is how I perceive what Obama's message is.
You said the question is whether the government can afford it. He said, we heard what he said earlier, that it will not add to the U.S. deficit.
Exactly. I mean, again, just to sort of make a crude simplification, how I see his proposal is that he's trying to spend more on precautionary medicine, stop more people getting sick, rather than the current system where they do all get sick and then get into the system of Medicare, which means lots of tests, unnecessary tests, lots of bureaucratic wastage, etc., once they get into the hospital. So he wants to prevent them getting into the hospital in the first place, which would entail savings. So if you had less people actually getting sick, eventually you're probably going to spend the same or even less on keeping the entire population healthy. But, that's a big transition. There's a transitional phase where the current system will continue with its imperfections while you're trying to change the way things are done and have more precautionary medicine being implemented, at the families, at the home stage, etc. So that's the danger. I mean, that with all this extra fiscal stimulus spending that we've seen in the last year, you go and add this on top of that, and you end up with a real budgetary blowout, which is just going to send the whole financial system into a tailspin. So that, I think, is why people are instinctively very, very cautious about going ahead with this, both in the Congress and the Senate.
Let's bring in my colleague. Mike, go ahead.
Well, one thing to think about is the American people, by and large, are very happy with the health care that they have. So that, in and of itself, makes it a difficult proposition to say we would like to have dramatic change. That said, for the very reasons your guest cited, the cost, namely, the health care system is definitely one of the ticking time bombs in the American economy. It right now makes up about 18% of the American economy, and by every projection, Republican, Democrat, conservative, liberal, that cost will only go up over time, particularly as baby boomers in the United States become Medicare patients and become Medicare eligible, because as we know, that's when most of the health care spending happens. So they're trying to change the conversation here, the president is, and he's trying to say that this is actually a fiscal issue as much as it is a health issue. And to get our fiscal house in order, you have to bring down the health care costs. So that's what they're banking on. With respect to some other things that the president has done in terms of spending a lot of money, one would be the bank bailouts. There's some evidence now that that's actually working. Goldman Sachs today announced that it was going to buy its warrants back from the government after having already paid back the bailout money that it got. Other banks are following suit. And the Bloomberg showed that there was about a 23% return for the taxpayer with respect to Goldman. You certainly can't do that with every bank, but that's some evidence that these kind of programs can work in the long term.
And Arjuna, very quickly, Obama's credibility hinges on this healthcare program because this is his top priority.
That's right. I mean, he's putting a lot of political capital into this issue. I guess looking at it from a political perspective, he is inheriting a very difficult budget. He's already said that in his interview just now, 7.7 trillion deficit and all that, and a big borrowing program. So that is a legacy that he just has to carry for the 4-year term. And when he comes up for re-election, I guess he, as as a politician, is looking for something that he can show in terms of actual achievement, given that the budgetary situation doesn't look good. So I guess, the calculus is try and make this thing work. It's been on the agenda for a long time. The Clinton administration tried during their 8 years to bring this. They didn't succeed. So, he has at least the advantage of a structure behind him, which he hopefully can repackage and then sell to the American public. That, I think, is going to be his big testing ground.
Okay, Arjuna, we'll leave it there for the moment. Of course, Arjuna will be with us for the rest of the hour. And we thank Mike Tackett for joining us from D.C. as well.